seeing the destruction, breathing in that air, it was quite clear that our lives would be forever changed. We can't change the events of that day, but we need to move forward and attempt to improve or at least preserve people's health.
Our story is not over. We continue to help people. By helping people, we keep the story alive.
Welcome to Aftermath, 9/11 Stories of Hope and Resilience. I'm your host today, Beth Fian. September 11th changed my family forever. My father-in-law was William Fian, first deputy commissioner, killed that day, highest-ranking member of the department, almost 72 years old. He was an amazing man. Telling these stories is personal to me, and I'm grateful to be here with the two of you to launch this series. Thank you so much. Today I'm joined by two doctors who have dedicated their lives in the service of others. Dr. Kerry Kelly, the first female medical officer in the FDNY history, and Dr. David Prezant, FDNY's current chief medical officer. Welcome to both of you. Thanks for being here.
Thank you.
Thank you.
Now, both of you were present on 9/11 and have been instrumental in creating the healthcare program the members have benefited from and utilized for the past 25 years.
That is a very true sentence because we are still seeing the aftermath of that day in terms of the physical and mental health of our members and the civilians and other individuals who are down there. Our work has been dedicated to the fire and EMS who responded that day and worked for so many days thereafter. And they are continuing care with us as new problems develop.
Our story is not over because we continue to help people. And by helping people, we keep the story alive. It is amazing how this program that the two of us helped to create has impacted on so many lives. Lives of our own firefighters and EMS members, but also because of the data that we have, because of the stories we've told, because of the successes that have occurred, has allowed so many other groups to be able to get health care from 9/11. And I think that will keep us alive forever.
Asking you both, roughly how many first responders are you currently treating? Do you have that as a
Well,
number?
15,000, roughly 15,500 members are enrolled in the program. About 10% of them are still active employees of FDNY. 90% have retired.
Got it. Dr. Kelly said to me last September, this is a story worth telling, the story of the aftermath. And that wasn't the word you used, but that's where we've landed here. And I have spoken to people about over 400 firefighters have passed since 9/11, and 343 were killed that day. Can you explain the statistics in that very human capacity?
I think that tells part of the story. I think the story that we need to focus on also is how many people are getting help, how many people have survived their illnesses or are at least doing well with the illnesses they have. I think our program has been devoted to finding illnesses when they're there as early as possible so that people can get help. We are instrumental in helping people find appropriate medical care. We're very lucky to live in an urban area where the top medical facilities have been participating in providing World Trade Center medical treatment to our patients. So I think that's an important part of the story. It's not just those who died that day or the people who have died since. And I think the sense of community that families have pulled together, and even when they've lost a loved one, they have been grateful for the help they have received through the World Trade Center program.
I think we should emphasize what Dr. Kelly just said, which is that people are living longer, right? And there's this sort of fatalistic feeling from all the deaths that have happened, from the funerals that everybody goes to on a weekly basis, that their fate is already in stone and that their next day may be the last, and it is so untrue. When we look at people with cancer in our program and track 5-year survival rates and compare those people in the World Trade Center Health Program to New York State residents never exposed with the same cancer. 5 years later, 86% of our people are still alive, compared to only 66% of those people in New York State never exposed. That speaks to the richness of this program. It speaks to the success of the program. And as Dr. Kelly said, it's the reason for that is multifaceted. Number one, as she mentioned, we have the finest medical facilities in the world in New York City, and they're all open to our members. But also, even 25 years later, and I'm going to say even 50 years later, the fire department is committed to taking care of its members. And when our members are sick, through Dr. Kelly, through so many other people, they are afforded a level of care that goes way and beyond what is just treatment. They're afforded social support structures. Volunteers drive them to their appointments. There's not a single firefighter or EMS worker coming back from chemotherapy that has to figure out how to get on a train, how to run to the bathroom and vomit in some subway. They're all taken care of in a very, very special, very, very human way.
That's fantastic. And it leads to my next question. Excuse me. What are some of the treatments that have advanced care? I mean, that have been discovered because of 9/11. What is there anything that stands out that the common non-medical person would understand?
Well, our research efforts are to document the story of 9/11, to make certain that we're providing cutting-edge therapy that's successful to all of our members, that we're tracking outcomes. But our program does not invent treatment, all right? So we utilize the very best treatments that are available. We made a commitment to every one of our members that we would provide them with the best treatment possible, because we knew the best treatment possible is available in New York City. So it's not like we've invented some new treatment, but what we have found is that through early diagnosis, early treatment, aggressive treatment, treatment without barriers, totally free, no cost, no deductibles, instantaneous treatment. We had one firefighter who called us and said, I'm insured in whatever health insurance he was in, and I've got throat cancer, and I've got an appointment at Sloan Kettering, which I had to fight for, but it's in a month from now. And we told him, no, we have an appointment for you in 2 days. All right. So it's that level of treatment that I think we have found to be effective, to be really a model for healthcare that unfortunately not often embraced to the extent it should be.
And I understand that there are still people signing up for the World Trade Center Health Program, both first responders and the general public. It's not a done deal. There are still people who haven't realized they can avail themselves of that.
Yes, I've talked to people who said they were down there and did not realize that they were eligible because they weren't ill at the time. And we said, if you're not ill, it doesn't mean you can't sign up to be a participant and go to some of the World Trade Center programs. So there is still the need for people who are down at the site, whether they were civilians or people living there, to continue to sign up as needed based on their exposure. And when you think about it, there were a number of schools right in that vicinity where some of those students are now adults, and we're now seeing some of the effects on people.
On younger generation.
Yes.
The World Trade Center cough syndrome, which must be pervasive in this population. Is that something worth talking about, or is that coming from having married in a firefighter family? I am aware of that and its impact on people. Firemen have that anyway, but in this instance.
I think well, first off, let's talk about the name, World Trade Center Cough Syndrome. Actually, it was given to us by our members. They said, I've been at the World Trade Center and I have a cough. And then when we would write out for getting various different tests, to get a test, you always need to put down a diagnosis. So shorthand, we started just writing down World Trade Center cough. So the name comes from our members, just like so many other things that we value, that we've expanded upon. They really come from the people that we treat. We're learning every day from the people that we treat. But the World Trade Center cough syndrome is an example of what this program can do, and that is it through the immense data that we have, it can document and substantiate some of the things that have been floating around in the medical literature. And one of those things prior to 9/11 was that cough results from what's called the one airway hypothesis, which is irritation from the nose, from the lungs, and from the stomach, all in one. And that is what the World Trade Center cough syndrome has proven to be. It's asthma, bronchitis, COPD, chronic sinusitis, and acid reflux, one airway.
Got it. Thank you for that.
I think also the World Trade Center cough became a symbol of the many symptoms we were seeing in our members after 9/11. Really, the information that was gathered through our health services after 9/11 became critical in helping people understand at least the short-term and now the long-term effects of the exposures. There was probably no group as exposed as our firefighters. We had a group of people who had pre-existing exams, who were well-working people when they arrived at that site. So we were able to document the significant changes in their health, and the cough was really just one of the symptoms that showed up and were part of helping people on a national level, and certainly from a value of helping start a program to address those issues that required financial backing, to make them understand that this was a group of people where a true change had occurred in their health as a result of this exposure. So the World Trade Center cough was really a very important sign of what was going on within our working population.
We're so thankful to our sponsors. We are here to tell the stories of all people from all different communities in New York and how this affected them. So thanks. Let me ask you a question about the funding, because people have asked me, and when I've talked about this podcast, is the funding threatened? Is the funding secured? Can you talk about that a little bit more? Are people still able to sign up? And, what's the status of the funding for a lay person listening to this?
The funding is secure.
It is.
The program is secure until 2090 as a legislated program that must exist. Now, that doesn't mean that the program is fully funded through 2090. Every once in a while, more funding needs to be infused into the program. The beautiful thing is that most recently, additional funding has been provided that should take us out many, many years. So funding itself, although we always need to make certain it's remaining current, is not an issue at this moment.
But when you think of funding, the needs increase as time goes on. Every treatment becomes more expensive. Every person often has other problems that perhaps need to be addressed when they're taken care of. So all of these add to the cost. The employees every year have new raises and more people need to be taken care of. So all these costs need to be factored in. So funding is always something that we deal with.
Yes.
I'm going to get a little bit on the personal side and steer away from 9/11. I have to ask you, Dr. Kelly, it is correct that you were the first female chief medical officer in the FDNY?
That is true.
That must have been monumental. What was the year that you became?
1981.
1981, and you served for 20-some years, right?
I left the department in 2018 for a month and then came back to work in the World Trade Center Fire Department program, where I'm still working.
And you've been chief medical officer since when?
Since when Dr. Kelly decided to temporarily retire.
So between the two of you, the history of medical care in the fire department is you are two of the most important people in this story. I'm so incredibly honored that we got to start this interview with you two. Is there anything that you want to share from the personal side in your roles as chief medical officers? Because, you go through medical school, you go through this, you go through that, and you've had this role in this institution that is iconic throughout the world. Like, can you tell me your personal story here of...
So I am the third generation fire person, and my father, I think, was happier when I got my job with the fire department than even when I graduated from med school. He thought this was the best thing that could happen. And I think, although you're thanking us, we are representing a team of people. And I think over the years, we were able to develop the trust of our membership by working hard to take care of the smaller problems, which weren't always so small, that occurred in our roles in medical care. We had the burns that were very significant, that were helped by the new burn equipment, and then that became a problem with people getting overheated. So annuals were not quite annual. Sometimes an annual could occur every 18 years. So we were able to change some of those things before 9/11 that helped, I think, the membership understand we were trying to do the best for their overall health.
What Dr. Kelly has taught us all is the value of personal relationships, all right? And she's both a physician to everyone as well as a friend to everyone. I know she's a friend to me, my best friend. And that goes a long way in convincing people to trust you and to help you and to work as a team. They talk about how politics is local. Well, certainly healthcare is local as well. And initially, after 9/11, the federal government thought that this program should be run by medical schools, by very great hospitals. And we said, no, we have pre-9/11 data. We have relationships. These are our patients. They're not your patients. And if we are going to do this right, then we should also be our own separate program. I know Dr. Kelly went to Congress and argued for that on the mental health side. I argued on the physical health side, and we achieved it. And years later, the head of NIOSH, which is our funding agency, the National Institute of Occupational Safety and Health, he came to visit us, to do a site visit, and he said that he was incredibly surprised that the greatest accomplishments have actually come from FDNY rather than from these very learned health institutions, hospitals that also have programs. We've worked as a team with them also, but we've learned from everyone.
Do the other programs have something similar to the Family Assistance Unit? Because that entity is so helpful, as you said, driving members and utilizing the service that is the family of the fire department. Do the general population or the police, do they have
the police
something like that?
Have built something similar, not as extensive, but something similar. The individual health centers don't have this because they, like us, really rely on our patients. So we have it because of FDNY. Many of the police officers have it because of NYPD creating something similar. But if you're not in either of those two organizations, you're left to your own device.
We will get into the general population. We have spoken to some folks that have it, and I have heard back from people who are registered in it that the care they're getting is top notch. So the money, the effort, and the expertise in the World Trade Center Health Program is incredible.
I think, so the addition that helps our members is those little extras that are not so little. When you know that you have 25 visits to get your radiation, and every day there is a firefighter in a car or EMT picking you up and taking you back. They describe the discussions in the car. They feel like they're back in the firehouse, and there's a positive value to those interactions, not just the miles traveled, but the conversations that occur. So many of the wives have said to me, thank goodness for that. It has made all the difference in my husband's care, because when I sat in the car with him, he'd be yelling about the traffic. And when he's sitting with the firefighter, they have a time of their lives talking about the olden days or what's going on in the firehouse. So that alone makes a big difference. The firehouses are communities in themselves, so people come forward to help the other people, no matter how long they may be retired. It really is a tremendous value that just can't be measured, but has made such a difference in our population.
And every one of these people that are treated become role models, so that they're able to convey to other people, this treatment works. Yes, they're going to take you. You don't have to worry about that. And role models are critically important in our lives.
Totally agree with that. So I just want to ask, in closing, both of you to tell me, the story of how this has impacted your life 25 years on. It's a big question, but if you can tell me in a minute or two what you think about that question and where it lands you, I'd love to hear.
I think being there that day and seeing the destruction and seeing or feeling and breathing in that air, it was quite clear that our lives would be forever changed, that the safety for my children would not be there. And at the same time, I think I felt very strongly that out of this has to come some good, and that we have to feel committed to making sure that we can't change the events of that day, but we need to move forward and attempt to improve or at least preserve people's health. And that became an important role for us to take on.
I think it's really made us realize how lucky we are to be part of the fire department, to be part of the World Trade Center Health Program, to be able to touch so many people. I often say to people that I'm a small-town doctor, because I'm a doctor for 15,000 people in the FDNY World Trade Center Health Program, and let's say about 15,000 current employees, so it's a total of about 30,000, which is a small town. It's amazing that how many people know you and how many people have come to trust you, which is really quite a gift. But it's a gift that you need to keep earning every day. You need to be fighting for that. And that's been my major takeaway, that this is a gift that we have to keep investing in.
Thank you so much for that. Thank you for listening to Aftermath, 9/11 Stories of Hope and Resilience, weekly on WOR, Sundays at 9 a.m. If you have a story to share, a memory, a photograph, or an artifact, we want to hear from you. Email us at aftermathstories@bethecanman.studio or DM us on Instagram at Aftermath Stories. Thank you both for being here today. I really enjoyed our conversation.
Thank you.